Good to go. We must be good to go because the recording's on. So, hi, everybody. This is Alice Bonner. I chair the Moving Forward Coalition, and I'm here today with Isaac Longobardi, our director, and wonderful speakers who are going to talk today with you all about a topic that's near and dear to everyone's hearts, I think, which is, more than just visitors, the role of family engagement and family and care partner relationships with individuals who are living and working in nursing homes. Again, we always want to be sure that we're talking about family, and sometimes that's biological family, and sometimes that's other people in someone's life who are important to them and they consider to be like family, whether they're related by blood or not. So what we're going to do today is I'm going to introduce our three panelists, and I'm going to ask them a few questions, each of them, so that we can kind of set the stage and they can tell you about their personal experiences, some of their professional experiences, working with nursing homes, and some of their advocacy. And then in the second half, we're going to open it up a little bit and have a little bit more of a free-flowing discussion. And hopefully many of you will be involved and engage in that as well. We do have, you're not going to be able to take yourself off of mute to speak, but we do have the chat function. And we encourage everybody, if you'd like to chat in your name and your affiliation, where you're from, we would love that to share with the other folks on the call. And if you have a question, please put it into the chat and we'll try to respond at the time or during the Q&A that we'll have in the second part of this call. So with that, I'm just going to describe and give a quick introduction for our three speakers today. We're joined by Stephanie Bailey, who is a licensed clinical social worker and program coordinator for the Caring for Caregivers program at Rush University Medical Center in Chicago. And she coordinates the Rush Caring for Caregivers program, which supports family, friends, caregivers of older adults, people 60 years and older. We're also joined by Libby Hoy. She's the founder of PFCC Partners, which was formed to create a community of residents, families, and healthcare stakeholders that are committed to the shared learning of patient and family or resident and family-centered care practice. Libby serves on many national and statewide efforts to promote a safer and more equitable healthcare system. And then finally, we're also joined by Janine Ferrari, who is a relationship builder, a manager, and a passionate advocate focused on solving problems and driving change, particularly in long-term care and long-term care reform and with nursing homes. She co-founded and grew the Family Council at the New York State Veterans Home in Montrose, where she advocates for her father and his fellow residents. And she'll share more about that today. And she continues to share what she's learned about building and sustaining family councils with families across the country. So before I turn it over to our speakers, and our first speaker, I wanted to just note that Dr. Jane Carmody from the John A. Hartford Foundation has joined the call. And Jane, I don't know if you want to make a remark or two just to welcome people to this conversation today, but if so, please feel free.
Well, thank you so much, Alice. Just a quick note, if at all possible, I don't ever miss the coalition conversations because they're always interesting and full of interesting people. And it is a privilege for the John A. Hartford Foundation to support this work to improve the care of nursing homes and, of course, to support Alice and team. And anything that I can add to the conversation, I will, Alice, but I'm just ready to hear these speakers.
All right, fantastic. Really appreciate that, Jane. And I have noted just now that our new policy director, Jennifer Baker, has just joined the call. And I wanted to introduce her to everyone. Jennifer is coming to the Moving Forward Coalition. This is just her third week, and she has jumped in with both feet. She comes to us with a strong background, having worked with ACL, having worked in a number of senators' offices, such as Senator Casey in Pennsylvania. And Jennifer, if you want to say a few words to the group before we dive in with our speakers, I'll just invite you to do that if you'd like.
Thank you, Alice, and happy Monday, everybody. It's really nice to virtually meet you. And as Alice shared, I just joined the Moving Forward Coalition as the director a couple of weeks ago, and just thrilled for the opportunity to help to advance quality care in nursing homes and care that's rooted in the perspectives of the older adults being served. And I think this conversation is just such a critical one about the partnerships that exist between family members and residents and community. And so I'm excited to learn with all of you today and for all of the many ways that we'll row together in the coming months and years to advance change. And just really appreciate your thought and action partnership in advance.
Fantastic, thanks. And Jennifer will chime in, she'll chat in or join the conversation at any point here today. So with that, Stephanie, maybe we'll start with you. And at a foundational level, why is the inclusion of caregivers in care delivery so important? And, maybe you also want to talk about some common challenges that caregivers face and how those might be different in nursing homes from other settings. So what do you think?
I am so happy to be here. Thank you, Alice. And so nice to see all of you and be here with such great colleagues and fellow fighters here. Great to hear from Jennifer, from Senator Casey. Wow, what a great advocate. So anyway, really nice to see you, Jennifer, and thank you, Dr. Carmody, too. And happy to be here. So yes, I jotted down some thoughts and I have, think a lot about this. So I think that all of you are probably really familiar with some of the challenges faced by caregivers, but I think some of them that are unique to nursing home settings and other settings are, of course, caregivers we know across the board tend to often be coping with many stressors that many of us are dealing with. So traveling, exhaustion, poor sleep, and worrying about their friend or family member. Of course, coordinating care, often they're having to update others, family members, other people that are also involved in the care of the care recipient or older adults who may or may not be as involved, who may or may not be helping very much, or may not be able to help, maybe out of the area and not able to do a lot. And so many times that caregiver is tasked with having to manage the expectations of a whole host of people in addition to the person that they are supporting. Family dynamics, of course, come into play, and just so many challenges. And I think in nursing settings, it's very important for us to include caregivers, obviously for lots of reasons. But one thing that I think we see a lot is when a friend or family member is visiting their person in the facility and the older adult is maybe given some instructions or information. For example, I know when I had a family member who was in a facility that was being told, okay, now physical therapy is going to come on these days at these times. OT is going to be coming on these days at these times. And also you're going to be seen daily by a nurse practitioner. You're also going to be part of some care discussions about what comes next for you. So there's 4 things already. That's not even everything to do with their care in the facility. And it can be really overwhelming for that person, especially maybe they're not feeling well. They have, they're dealing with many things that they're trying to recover from. And so I think the caregiver in this situation, it can be really helpful and necessary to have them be part of those discussions and really be reinforcing those things with their person. And any of us, a lot of times I've heard that we really only take in a small percentage of what we're actually hearing. And I know that's true for me. You're thinking about the next thing you got to do. You're thinking about did I park in the right place? Am I going to get ticketed outside this facility? Am I, what's my next errand I have to run, and who do I have to help next? And so these are all such important things, but we can help the person who is being cared for to reinforce, okay, I heard them say the PT is going to be here tomorrow, even if it's just that one piece that we got. Okay, I heard 10 a.m. tomorrow, got to be available for the physical therapist. And so they can reinforce those things. And I have a feeling a lot of you all are doing that for your friend or family member who's in a facility. And it's also important, essential to include those folks as part of the care team, not just, a visitor, but as you said, not more than a visitor. We want them to be very much included. And there are different ways they can do that, that we all can do that. One thing that I wanted to point out, I don't want to go over my time, so let me know, but to really engage those folks in a way that works on an individual basis for those folks, because we know there's different learning needs. We know there's different ways of understanding information and processing information. So one thing that can be really helpful is almost doing kind of like a teach back model, where people are asked to repeat back to me what you heard. We can do that with the caregiver and say, do you understand the, kind of schedule? Do you understand what the goal is in this care? Do you understand what comes next? And what's most important to you? We really need to be asking them, as all of us are doing, but we can reinforce this with others to really talk to the caregiver about what's most important to them. What can we do to support them? And just really hearing them, sitting with them, hearing them, including them as part of the care team. And I had a couple of thoughts as well about just ways to make sure that they're included in some of the family councils that many of you are involved with and have started, to make sure that, they're accommodated, that maybe this time of day doesn't work for their schedule. And so we want to include them at a time that works best for them, or in a method that works best for them. And yeah, I think those are my initial thoughts. So
Well,
I'll hold it to that.
Those were a lot of great initial thoughts. And I love how you mentioned teach back. So for those of you who've not tried using it in your daily lives with other family members or anyone you interact with, it's super helpful. It really works. So, and I heard you say, listening to people, really listening to them, really helping them, whether it's through technology or other methods, to be able to track the things that are really important to them. It is so hard if you are, a family member, a caregiver, or a person who's living in a nursing home, to keep track of all the things that are happening. It's just really, really hard. So I think your points about all of those things and the person-centeredness that you mentioned are all really valuable. So thanks for that. We're going to go on and talk to Janine for a couple of minutes. And Janine, you're a family member who has, worked with nursing home residents, and you've organized that nursing home's family council. Why did participating in the family council, why did that really matter to you? And again, maybe you can talk about any challenges and how you faced those challenges to make that work more effective over time. So what would you like to share with the group?
Well, thank you, Alice, for the opportunity. And I would like to share that we started our family council we called it a family group, in May of 2020 at the height of COVID, to meet other families. We initially fought, and now I use the word advocate, but we didn't know the word advocate then. We didn't practice it. We were fighting for visitation and transparency into what was happening at my father's nursing home. He lives at a New York State-run VA nursing home near West Point. Once we were able to visit our loved ones inside the nursing home, we saw how the lack of staff affected the residents, our residents, and how the nurses and the CNAs who were trying their absolute best to care for our loved ones were affected by that short staffing problem. And together, our families realized that we could affect change more so than single voices together. So together, we've reached out to legislators. We have reached out to our state ombudsman, our regular or local ombudsman. We've reached out to Leading Age, basically every nursing home advocacy group for guidance and tips. And we have grown our family council. We started first with 15 people, which went to 40 and then 60. And we're currently at about 175 people signed up to our family council. And the census at our nursing home as of yesterday, I think is 201. So I'm always, you know, I've got the carrot in front of me. I'd like to have 201 people signed up to our family council. So basically the overarching reason for us participating in the family council was to have a voice that was recognized federally and statewide as an advocacy voice. It was challenging. We did have some challenges initially from the administration who blocked our entering, blocked they accused me of soliciting because I'm a salesperson. My career was in sales for high net worth or two net worth individuals my whole life, luxury goods. So I'm very well versed and comfortable trying to develop relationships and just talking to everyone, anyone who walked in, any family member. I'm not shy, and I was warned not to solicit. Of course, I worked with my ombudsman, Judy, who is an angel, and she encouraged me to just keep on doing what I was doing. I was not soliciting. I was just being a family member. I was accused of harassing a resident who I befriended. Judy again helping with that. And we were made to work with Judy, our ombudsman, who then also enlisted our state ombudsman, so that we were recognized as the de facto family council for our nursing home, because they were insisting we weren't the real family council. And that really worked. I would say if you haven't met your ombudsman already, or you haven't worked with them, give them a chance. They recognize the importance of family councils. Family councils help ombudsmen so that they can focus on the residents who don't have an advocate in their life. And they recognize that family councils help them by putting out the small fires so they can focus on the large ones. I hope that answers your question.
Absolutely. And we've got some activity in the chat. So you're talking about the ombudsman programs, and as people probably know, the Moving Forward Coalition does a lot of work with ombudsman programs around the country. There are local programs, state programs, and federal programs, and some independent ombudsmen as well. But in the federal, regulations and the legislation, the ombudsman program is, the only program that's, solely dedicated to supporting nursing home residents and what their needs are. So that's who they are designed to serve. And so Kathy McIntyre chatted in that she's an ombudsman. She's with us on this call today. So we're very grateful for that. And I know we have other people on this call who are working closely, as you are, Janine, with their ombudsman programs. So as things change and there's a lot of different approaches that happen over time, I think it's just important that we remember not to take our eye off the ball when there are, critical programs like the Long-Term Care Ombudsman Program that we want to continue to see to be well funded and supported. When the programs have the resources, then sometimes ombudsmen in certain parts of the country are in a particular nursing home, maybe a large nursing home, maybe they go once a week, maybe they go twice a week. In other parts of the country, these are a lot of volunteers, so that's not necessarily something that's able to happen as much. And especially after the pandemic, there was a lot of change where, there couldn't be as many congregate activities or outside visitors as we know. So all of those things are important. And, I chatted in and asked people to also, respond if they're part of a family council in a nursing home or patient and family council. So I think all of that is really, really valuable information. And maybe we'll keep talking about these things. We'll turn to Libby Hoy. And, Libby, you've also organized patient and family advisory councils. And, more recently, I think you've also looked at more adaptive and flexible approaches to include family members, and particularly around organizational feedback and decision-making processes. So maybe if you could, describe some of those innovations and why they matter and how they might be adapted in a nursing home setting, that would be great to keep the conversation going.
Thank you, Alice. And thank you so much to all of you. Oh, of course, I get a frog in my throat right now. I am really delighted to be here and learning with all of you. I started on a patient family advisory council for my children's hospital in 1995, like really archaic. And way back when all of this was really getting going. And over the course of the ensuing 30 plus years, we've learned a lot about how effective resident, patient, people, community, and importantly, family voice is to building the kind of quality organizations that we all need to see, right? And so our organization, as Alice mentioned, supports health systems, research teams, measure developers, basically anybody who will talk to us to build the infrastructure for meaningful person, resident, family engagement. And we're a little bit focused on more of the organizational development, if you will, than on what you've heard between the family and the resident and the caregivers or the nursing home, because we recognize both are necessary. We have to focus on giving people, what matters to them in all settings of healthcare. But to do that, we feel it's really important to build some infrastructure under that. And so, ensuring that if you're having a conversation with a resident and their family caregiver about what's really important to them on a daily basis, is there anywhere to put that in the notes? Is there any method to get that to the next caregiver? Is there any, accountability built into that system? So we want to build those mechanisms, but we want to build those with the family caregiving perspective and with the resident perspective so that they're really meaningful. And I think in particular around quality improvement, as we think about quality improvement in nursing homes, there's some definite opportunities to bring in patients or residents rather, and really importantly in the nursing home environment, family caregivers have critical insights to inform our quality improvement. And the golden nugget about engaging that perspective into quality improvement is that we ensure we're solving the right problem. So data tells us what's going on, tells us what our problems are, but the people, the residents, the family caregivers, the bedside caregiving staff, the people tell us why these things are happening. Again, so that we're ensuring we're solving the right problem. So I think as we think about these family councils and really strengthening their ability to partner with the nursing homes to address their quality improvement goals, right? So engaging in preparation for family council members to have some background around quality improvement, to understand what is the nursing home's priorities, patient safety priorities. Having that background allows us to then to come in as family caregivers and let you know what we see, again, so that you're solving the right problem, okay? We were chatting with a nursing home a little while ago about this, and they were wanting to reduce infection rates. That makes sense. So they were starting with a resident and family education. It's a good, reasonable way to go. But then when we started talking with their family council members, they said, you know what? The stuff that's going on under the beds in some of these residents is really creating an infection hotbed, right? A petri dish under some of these beds. And I don't think anybody is looking at those. So they went back to look at those and realized there was a huge opportunity to really kind of clean up what was being hidden. So you can see, you could start a patient education or a resident education program, but would that have solved the problem? Maybe not. Maybe it would have made some progress, but now you have this new piece of information to act on. So I think that that's really important. And then secondly, am I okay on time?
You're fine.
Okay, you know how I can go on about this stuff. And then secondly, what we've learned more recently with our PFA network, so we have a community of over 1,100 people like myself and like Janine who are using our lived experience in organizations to partner and in improvement in quality and safety. What we learned from that group was that, a lot of family councils, a lot of patient family advisory councils look a lot like me. We're not meeting our diversity goals in these groups. So we really dove in, particularly with underrepresented populations from our PFA network. And we were really challenged by them to say, what you list inclusion as one of your core values. What do you do to be inclusive? And really challenged us. And we're like, we're really welcoming. That's not it. So what we were challenged to do was set up almost a no wrong door for people to engage, for people to bring their insights. So instead of having people come and bring their thoughts to once a month family council meeting, we use that family council meeting to really identify priorities and then move it out. Have a listening session, have an interview, make multiple avenues for people to engage and provide their insights to partner with you on improving quality. And we've been doing that model for about 4 years now and have elevated the diversity by focusing on inclusion. So I think that's also relevant in nursing homes as well. And again, there's a million different ways to get the perspective of your residents and their family caregivers, and it's only going to feed your quality improvement work. So that was a big aha moment for us to kind of adapt to advisory councils transformed, or our ACT framework, which provides that no wrong door to engagement. The other thing we figured out, though, was while we were working in rural health communities, we figured out this model actually is less burdensome to the organization. And I know nursing homes are working really hard and don't have a lot of spare time. So this more inclusive framework then provides for less of a burden on the organization and increases your diversity, which is going to increase your impact. So that's some of the stuff we're excited about.
Yeah, those are great points. I love how all of you as speakers, you each brought, some really unique points, and, that those issues about inclusivity and making sure that, the people on the family council look like the people who are living in the nursing home to the extent that you can. And I loved how you talked about the intentionality that was required for you to get there. It wasn't a quick overnight thing. And sometimes that's true of building out these family councils. But I think each of you kind of talked about ways that you really developed these approaches to make sure that you could get there. And it takes time. It's not an overnight thing. So, well, I think we are at the end of our sort of panel discussion, and we do have a few more questions for you guys. So I'm going to turn this over to any of you who want to, take on this next idea. You've all talked about family members being part of the interprofessional team, and that team is centered around and driven by nursing home residents themselves. That's who should be driving these processes. But, it may require, supporting family members with educational materials. And in a lot of cases, like what Libby was just saying, they may have unique educational needs. What's their first language? Is English their first language or something else? What's their educational level? What do they already know, or what do they not know? So what would you say, based on your experiences, any of you guys, what should that education look like? What do you think family members or care partners need to know about being part of this?
I'll jump in.
Okay,
I'll go
for
next.
If you don't mind. I think family members would benefit from an orientation. Many times, well, actually all the time, a resident is admitted into a nursing home, but a family is just left there, right? You walk out and you're by yourself and you don't know what the next day brings. You don't know who to get in touch with. You may not have the phone numbers for the people who you need to get in touch with. You don't know any other families. I think families would definitely benefit from an orientation since residents receive one. Who to contact for a doctor's appointment, behaviors to expect during a resident's first few weeks during living in the nursing home. That phone, an email directory for nursing home staff is huge. An introduction to the family council. What is a family council? How can they help you? Why not join them? Available services that the nursing home might provide. How to escalate an issue the right way, following protocol and procedure. Understanding how to advocate for your loved one in a professional, non-combative manner. And what I found most important for me was what to expect with Alzheimer's and dementia. My father has vascular dementia, and I had no clue where to go for information. I know there's a Caring Kind and there's Alzheimer's.org, but it's for me, I found it better and more impactful to be taken under the wing of another family member and introduced to these things, these ideas. It was more personal and it was therefore more impactful. And I've been able to pay that forward. And we teach our family council members to keep paying it forward so that everyone feels included.
Right. And that peer-to-peer support there's nothing like it, right? It's just, you need to be able to share your experiences with someone else who's gone through it. And that's different from, the nurse or the social worker coming in and having a conversation. That can also be helpful. And I always tried to be helpful when I was that nurse, but it really matters that you can talk to somebody who's been that family member or care partner as you have. And you mentioned something really important, I think, which is you talked about cognitive changes. And so there's multiple types of dementia, as we know. There's other challenges people have with cognition, from head injuries and all kinds of different things. And, Stephanie, when I think about the Caring for Caregiver program, and any of you can chime in here too, but what do you think specifically about any sort of orientation, support, education when the person living in the nursing home is someone with some of these cognitive challenges?
I think, yes, such a good question. I think caregivers in that situation can be coming in so isolated and overwhelmed. If they've been caring for their person with dementia for a long time, even for a short time, we know how isolated folks can get, because as their person maybe gets more unpredictable, more prone to wandering, more a little bit, socially saying odd things. And I've had caregivers tell me they would be too, they felt even more homebound, which of course was exacerbated by COVID 5 years ago, and for longer and longer that it kept going on, where a lot of their classes and outings and things that they used to do were no longer available, and really took the longest of anything that I was aware of to come back to an in-person status. So, which is a whole other issue. But I think that folks might be coming in so isolated and lonely, that the caregiver, that I love the idea of an orientation book or packet or one-on-one meeting, but even better, what you mentioned, Janine, of almost like a mentor or peer-to-peer, someone that can personally welcome them and say, hey, I noticed y'all just moved in. I'm also a it's often the family member, not to exclude friends, others, but to say, I'm also the daughter here, and I noticed you here. And I'm not sure how, but an organized response to that would be completely amazing, to have a peer-to-peer, organization, and letting folks know, this is here. We have a council, it meets on this night. We'd love to have you. You can call in if you can't be there. This is how it works. This is what we'd like to hear. Because yes, the challenge of isolation is what I see is probably the hardest thing faced by families and friends of those with dementia.
I think that's such a good summary that you gave, and both of you. And it also makes me think about ways to engage other people who are part of the care team, right? So maybe it's a certified nursing assistant or a CNA, maybe it's the social worker or a nurse, or could be anybody on the team, could be somebody who works in nutrition, but identifying that family member or care partner, it seems like they are, feeling isolated or sad or stressed and anxious. Those are all different ways people, can be feeling when someone that they really care about is now living in a nursing home, and especially if they're not included in some way in working with the team on that, on that person's care plan, or just figuring out their quality of life and what's really important to them. Some of you are involved in the age-friendly health systems movement. And again, what matters most to the older person is absolutely central to that. And so, family councils can take on those kinds of questions too, and help as a team to be able to build out working with residents on those things. Libby, I don't know if you want to go back to add anything. When you were talking, all three of you were really talking about, how can families get more involved in the decision making and in quality improvement without being seen as, oh, here she comes again and she's just complaining about something else. Like, that's not what the goal is. It's everybody's got this, should be same team, same mission, but we know that doesn't always happen. So do you all have any advice for any of the folks listening in on the call today for how you've kind of promoted, getting people from the community, families, care partners more involved in the decision making?
So before I respond to that, I just wanted to reflect back as Janine and Stephanie were talking, I was thinking, wow, wouldn't that be such an amazing thing to build a sense of community within the nursing home? Then it would really be a home if the family caregivers were supported like that and everybody was involved. And I think, Alice, to answer your question, that's kind of what we're trying to do when we talk about engaging that perspective into quality improvement efforts, or, because everybody has insights into the environment, right? The staff that are frontline do, the residents have important insights, and the family caregivers have really important insights. We sit around watching all day long, right? We see a lot of stuff that looks just part of the environment for some of others, staff members who might be there regularly. So I think as we build the will, it's about partnership. And so for our organization, we term ourselves patient, family, resident partners. And we do that intentionally. While we are advocating for change and advocating for the well-being of our loved ones, we're offering ourselves as a resource to partner with organizations, to partner with the nursing home administration, to address these common priorities. So I think for us, when we're starting with an organization, we always start with scope. Where are you engaging your family council members? What is the scope of that engagement process? Because scope drives everything. It drives how do we prepare our family council members to participate in that particular issue. It drives kind of who's recruiting, who is that relevant to? If we're wanting to understand the needs of second language learners in our nursing home, I'm not going to be the best person for that, but we have families in our resident or in our nursing homes that can inform that effort, right? So I think a really well-defined scope, and then preparing all of the partners for partnership and coming at it as a resource to solving problems. I think when we have a clarified North Star of where we're trying to go to together, it makes it a lot easier to sort of round our edges and move towards that common goal that we both have.
Yeah, those are great suggestions. And, that focus, that sort of really clear and narrow focus when you're starting, so people really get what the family council can do, what they can be about, but that it very often is helpful to just have one area that people can kind of, coalesce around and agree on for something that they want to start with and then expand to other areas. I just want to make sure people are getting a chance to read. There's some really good information being shared in the chat about approaches that different organizations have taken, about resources people have that they've shared in the chat. And so, please take a look. And, Nancy Kusmal, who's one of our Moving Forward Coalition members and social work background and faculty, said, many staff want to do better, but don't feel like they have the time or space. We hear that a lot. I'm sure everybody on this call probably does. And so starting from a place of partnership can give them, the ability to get that relationship off on the right foot. So Nancy's saying, what resources do we think staff need to do that better? And so question to you guys, and then people can chat in as well. Besides what we've already mentioned, are there particular guides for family council? I know Julie Bogus chatted in one resource, but Stephanie, anything from Caring for Caregivers, or Janine, anything you or Libby have used? Yeah, we'll share any resources that were shared in the chat. So
I would immediately, the first thing that comes to mind is, I had the benefit and the luxury and the opportunity to work with the Long-Term Care Community Coalition, the LTCCC, for a couple of years, forming family councils, helping people form and maintain family councils. And they worked with me to build a toolkit, a family council toolkit, which you can find on their website. And as we go along here, I'll put the link in the chat so that people can download it. It's really helpful. You can build on your family council from there, but not knowing what to expect, this really lays it down, the foundation for that, and it makes it pretty easy.
That's great. And LTCCC is led by Richard Mollett and others. They're based in New York, but they do a lot of national work. So thanks for that, for chatting that in. And we did want to note that, family council adoption is only about 13% in nursing homes across the country, compared to resident council adoption, which is at 94%. Of course, that's required in the regulations, for the nursing home regulations, that the nursing home has to support a resident council if even one resident wants to do it. Whereas family councils are, not as strongly worded in the regulations, but the opportunity is there, and it should be something that we figure out, how can we get to a place where we have stronger, not only resident councils, but family councils? How can we build that structure for family councils? So maybe with that, as continuing this conversation, we have about 15 minutes left, or 10 to 15 minutes left. We can kind of open it up and go to being able to see everybody, if we can do that, Isaac. Otherwise, we can stay spotlighted, the four of us. But would just love to hear from anybody else in the audience, any of the people. Oh, thank you. That's perfect. Anybody on the call today, you've heard a lot. And again, in particular, I know I see Jeanette on the call, and Marguerite. And I think Frank was on earlier also. So I know we've got those folks and a number of other nursing home residents. I see, other people. And anybody, would be interested to hear from anybody about your thoughts on this. Have you tried to build out a resident council, a family council in the nursing home where a resident? And anything else you'd like to add to the conversation that you've heard here today? This is not an easy proposition. This is, people like Janine and Stephanie and Libby and many of you on the call have been working on this for a long time. Not easy at all, Karen says. I know Anna Fisher is on the call too. Anna has done a lot of national policy work on these issues. Anna, I don't know if you want to add anything to any of the conversation so far. Oh, you have to raise your hand. Sorry, I didn't say that in the beginning. If you raise your hand, Isaac should be able to unmute you, but you have to request to unmute.
There we go. I think,
There you go.
good afternoon. Wow, this information has just been fabulous. And even though I am in long-term care and I've been a caregiver right now, as well as with my dad, my mother-in-law, and just when you think you know it all or what to expect, it's like, wow, it's all so new. You know, I think Alice and team, what my recommendations are is just continue to ask, probe. It's okay to show your vulnerability. This is how we learn and move forward. And I think so many times, and Alice, you know, I'm a nurse saying this, is sometimes as a caregiver, we do not want to be perceived that we don't know what we're talking about or we don't want to share. And it's okay. And it's even taken me a long time to recognize it.
Mhm.
So I hear a lot of the relationship building, the trust, the support. That is also vitally important. I think
Mhm.
relationships is key, especially with the nursing home and the communities. And just don't be afraid to reach out and ask, because we
Mhm.
don't know what we don't know.
Well, I love that, Anna. As always, we can count on you for that advocacy underneath it all, and just and that element of saying, don't be shy. You know, if we don't do it, maybe no one's going to do it. So it's got to be us. And, you know, we need to talk about this. We need to bring it forward, not just once. I mean, Janine was chatting with us before the call started and saying how many times she had to go back and back and back. And, you know, that shouldn't be the case. But if it is, then let's figure out, you know, how to make this really work. I know we've got a few other, we've got several coalition members on the call. I know we have Barbara Bowers from Wisconsin, and I saw we have Paul Falkowski, who's led some work we did in New Jersey. And Paul, I don't know if you want to come off of mute and say anything in terms of life enrichment and some of the volunteer programs and how any of that might intersect with family engagement in any way. You have to raise your virtual hand and then we can unmute you. I don't know if that's, there you go. Oh. Well, we can't hear you, Paul, but sorry about that. I know you're off of mute.
Probably
Anyway,
several microphones, so
there you go. Now you're on. Go for it.
of mice and men.
Yeah.
Anyway, well, my song is increasing community engagement. And so we're in our organization, we're working very hard to recruit what I call companion volunteers for people that do not have families, who's visiting them. And so today I was at a large community here in Philadelphia, and I had a booth set up, and we were talking about this, and resident after resident really identified with the idea, you know, that there are people in that community that are not getting visitors. They don't have any family, they don't have friends nearby. And so who is there for them? And I think it's a really good handshake with the Ombudsman program, because I've been talking with people in that community, and you know, sometimes a person will think that they would want to become an ombudsman, but when they see what's required, they might back away. And instead of losing that person, they'll refer them to us, and we'll put them through a lot less training. But what we'll do is we'll make sure that they get into a care community as a companion volunteer. And then I've had companion volunteers go on to become ombudsman.
Mhm.
So it's all, for me, it's all about just getting them in the door.
Yeah, no, that's great. And that's again, good advice. Who's out there recruiting people and getting them in the door? Something like 50% of people who live in nursing homes never have a visitor, never. And that's, you know, we've got to change that. And volunteers can come in and build relationships and rapport and, you know, do activities with residents and all of those things. So I think all of that's valuable. So thanks for those ideas, Paul. Really,
Yeah.
really appreciate that. And again, I know we have people from some of the national organizations that are working with states. And this is, again, another opportunity. How could any of us, work with our state government leaders or even local municipal, government leaders, mayor, town council, to really focus on the need to engage with people who live in nursing homes. And, to your point, Paul, it can be people from the community. It's not necessarily just biological family. That's not what this is about. It is about that, but it's also about other people who can come together and volunteer, and how to make nursing homes part of communities, and how to make nursing homes seen as leaders in aging programs and services, and not just places that nobody ever goes to and doesn't, they don't really know about. I'll also add to, this conversation in terms of how can we really promote family councils even more. A lot of the work that many of our organizations do with legislators, now that could be state legislators or it could be people in Congress, they don't necessarily know about nursing homes. They might know about senior services or community services, but if you ask, who lives in a nursing home or who works in a nursing home, how many nursing homes are there in the United States? A lot of times people really don't necessarily know the answers to those questions. So again, just something to keep in mind that, if that's part of your organization's role, can really, do more with that. And I don't know if, Stephanie or Libby or Janine, if you've had experience with that, any sort of active work with legislators or anything to promote family councils from sort of an advocacy and again, more of a legislative approach.
I can tell you, Alice, that Michelle and I, Michelle, who's on the call now, she's our family council co-founder and my forever sister. We're right now working with Mike Lawler. He is the congressman for my father's district. And we were able to get him in last October to come and talk to the residents, and they felt heard. And that's what enabled us to begin working with the resident council. So both the resident council and the family council are now working together in our nursing home. And it's really exciting because it's no longer what we think the residents want. It's very easy to fall into that trap as a family member or as an advocate. They're telling us what they want. So we're working together with them. And Congressman Lawler is coming back, if not this spring, then in the summer, to address the residents once again.
Oh my gosh, that is awesome. I mean, the collaboration among the residents and the family members, and getting your congressman to come in and speak to the residents and really listen to them. Fantastic. We should all try to do that in our areas. You gave us a best practice, so thank you for that. Sean Gillis, Sean, your hand is up. We'll try to unmute you here. Okay, go ahead, please.
Hi, thank you for having me. Has there been any discussion, or is there even a way for residents with dementia, regardless if they have family, is there a way to give them a voice, even though they're incompetent? Is there any discussion of that, any work on that? Can anyone speak to that, whether on the panel or in as a participant here?
That's a great question. I'm going to turn it over to the panelists. And Stephanie, I think that Caring for Caregivers, you've had some conversations about that, and Libby and Janine may want to jump into, but go ahead.
Yes, I think I don't know the answer to that. And I think it is such an interesting puzzle and such a great point to bring up. I think, at Caring for Caregivers, we're trying to help family friend caregivers along with their care recipient identify what's most important. So for the caregiver and for the person they're caring for, to, tell us what's most important. And we will try to ask that care recipient when it's possible. And I'd love to see nursing homes be asking each resident one question, maybe upon entry: what is the most important thing to you? Maybe that could be a way to, if there was one thing we can do, what is most important? And I don't know how possible that is, but I really like that. I think that is so important to include all residents, regardless of how well they are. Yes, many of them are having those cognitive and memory issues, and that is well worth still asking that question. And exactly, yeah, I appreciate all of these comments as I see them come up. There's such good comments and ideas that you all are sharing with one
think that's-
another.
Yeah, and I think it's a particularly good question, Sean, because, we don't want to exclude people who have cognitive challenges, but we may want to include them and a family member, or if someone's an official healthcare proxy or agent, for example. But there's a lot of complexities, which you pointed out. I will say, to Stephanie's point about asking what matters, that is part of one of our Moving Forward Coalition priority projects right now that's going on, our pilot in the state of Kansas, that's led by Lacey Cornelison and Addie and a great team out there. So we can see how they do with individuals who either have a diagnosis of dementia or have some other cognitive challenges. I think it's a really, really good point. So thanks for raising that. Libby or Janine, did you want to add anything briefly? And then I think we're going to wrap up, but anything to add?
Yeah, sorry, Libby, go ahead.
Oh, no, you go ahead, Janine.
I know, I was just going to say, I found just when you ask a simple question, even if someone is not mostly verbal any longer, they can still, if you just show patience and use your powers of observation, they will be able to answer that question. What would you like to do? Or if you even rely on their neighbor, their roommate, or the people that are around them a lot, the other residents, they give you insight into what your resident might like. They're watching.
Right.
They sit there all day. They have the power of observation. I would use them. And you're making a friend.
That's right. That's great. Libby?
Yeah, I guess I would just go back and focus on inclusion. So for our community, we have a communication access plan, and that helps us to ensure that we're being inclusive for everyone, whether they have cognitive or other disabilities, whether they have language, second language learners, whether they're elderly and have difficulty accessing technology. That wasn't a blanket statement, just some of our community members do. Others are better than I am. So anyway, I think if you focus on inclusion, the residents will tell you how to engage them. And those were all some great concrete suggestions, Janine. I love those. So have a conversation with your residents, have a conversation with their family caregivers, and say, how can we elevate this voice in our nursing home?
Right. Great. Well, that brings us almost to the top of the hour. And I just want to thank Stephanie, Libby, and Janine for their wonderful comments and participation today. And again, just any final words from Jennifer or Jane or Isaac. Otherwise, we're going to close out for today and look forward to the next coalition conversation. But this will be Isaac's last coalition conversation. Tomorrow's his last day with us, but he won't be far away. So anyway.
Thanks, Alice. And I just wanted to say this coalition conversation was at the suggestion of Janine Ferrari. And I put in the chat a link to suggest a coalition conversation. So if we do read those, please send us your suggestions. They're very helpful to us. We'd love to make sure we're doing conversations that speak to your interests around nursing home quality and care. This has been fantastic. Thank you, Alice, for leading, and thank you, Libby, Steph, and Janine for being our wonderful panelists. Our next coalition conversation will be in late May. We'll get that up shortly, but it will be in relation to nursing homes and homelessness and how they intersect. So it should be a very interesting and important conversation. And we look forward to hopefully seeing you there. We'll send out a newsletter with that information as well as the recording of this call.
Great. All right. Thank you so much, everybody. And we'll see you on the next conversation. Appreciate everybody joining today. Thanks.
Thank you
Bye.
all. Bye.